I'm the Vice Chair of the Health Ealing Board, but I'm also the Borough Medical Director for North West London ICB. I'm here to replace Peter Mason, the Chair of the Health and Wellbeing Board, who's unfortunately had some other engagements this afternoon. Also want to welcome everyone who's on screen as well. You all noted that we've now decided to have the Health and Wellbeing Board in the afternoon rather than evening, and I think that's a really good opportunity to allow other attendees from our partnership to attend. So I really think that's really a positive a step that we have undertaken. I'm not going to do a round of introductions. Whenever anyone speaks, if they can just introduce themselves, that will be really good. So let's begin. Akesha has noted all the apologies of attendance, and so just a few business matters first. Are there any urgent matters which we need to discuss this afternoon from anyone? No. Right. Any declarations of interest which haven't been noted previously? No. Great. Okay. And are there any matters to be considered in private? I've got nods as well. Okay, so item number 5 is the minutes from the last meeting, which was on the 8th of May. Are there any comments or any amendments to those minutes, and are we happy to approve them? Yep, we're all happy with those. Great. Okay, so let's move on to our first substantial item, which is the Adult Social Care Partnership Board's update, and in particular reference to the revised framework for the strategic co-production. So Avatar, is it you and Kerry going to be leading on it, and Polly?
Yeah, if okay, Chair, I'm going to do a brief introduction and then hand over to Connor, who I think is online and is one of our co-chairs of one of the boards. If that's okay, I'll just very briefly introduce the report and say how pleased I am at the progress we've made in creating the partnership boards. It's a key part of the council strategy to work with our communities and work much more in conjunction with people, particularly with lived experience, to inform and shape the services that we provide and make sure we're putting communities at the heart of everything we do. So this has been a wide-ranging piece of work, and thank you to Avatar and team for everything that they've done to make it happen. It'd be great to hear from Connor as one of our co-chairs, who will have a very interesting perspective on what that means kind of out in the wild in that sense, and how it really feels to be part of council decision making. And to have a voice in the way that we provide things. I do wonder if there's further opportunities as these evolve and develop for aligning with other engagement boards that I expect that we have across the piece within the NHS and beyond, around engagement with patients and residents, partly to avoid duplication, but also to amplify and elevate what we're doing if there are opportunities for our residents across the piece to be informing what we do and getting much more involved. So a great flying start, lots more still to do and lots of opportunity to really deepen those relationships. And if I could pass over to Connor, who I believe is online. I think I can see him on the square there, and here comes Connor, and thank you very much again for all the work that's happened, and looking forward to hearing from you, Connor.
Thank you, and thank you for having me, everyone. I'm Connor. I co-chair the Autism Co-Production Board, and I've been co-chairing it for the last couple of years, and I've seen it go from there being a lot of people from outside, predominantly parents, coming in, and it started off quite rocky, as you'd have a lot of people who had the belief of oh, my child's autistic, perhaps we should do this, and it wouldn't work as well as they'd hoped. But there was a massive, how do I phrase it? Everything was kind of cleaned up a little bit, and we involved way more professionals, some people who worked in schools, people from the NHS, psychologists, people from the council. And especially over the past 12 months, we've really been focusing on what we can do, what services could be improved, whether things do need to be more tailored towards people who are autistic. We've come up with quite a few plans and quite a few projects which are currently moving forward at the moment, and progress is looking really good.
Connor, thank you so much. It's really great to hear that you've been involved, and thank you so much. The time and effort and energy and passion of residents that choose to become part of these boards is really valued. So thank you. Avatar, is there anything you want to add?
Yes, just to add, this is an example of the impact that the partnership boards can have in terms of improving outcomes for local residents, but also influencing how services are delivered in a way that matters most to them. So the Autism Partnership Board is a really good example of that, the transition that's gone through since the review that took place over a year ago. We are implementing the recommendations of the review, and the slide deck that's been submitted as part of the papers talks about a new structure. That structure is iterative. So as we implement this, the new way of working, it will be subject to change, and it is at the control of the residents that participate in the co-production boards, our professionals, our partners, our key colleagues, and also overseen by a strategic partnership board, which is chaired by Kerry. It is work in practice. We are getting some really good returns, really good outcomes. But as ever, there's always challenges around making sure we have the right level of participation and co-design, and that's always going to be an ongoing process. As part of this, we've also set up a dedicated inbox for new applicants to the co-production boards. It's a regular item on our adult social care newsletter, so we are promoting as much as we can. In terms of next stages, it's really to kind of switch the relationship over, where the co-production board sets the working plan, and a draft plan has been submitted in the slide deck in terms of what's important and how we can improve services for local residents. That's pretty much in short.
Thank you so much, Avatar and Connor. I don't think I have anything to add. I feel like I'm chairing the meeting, so I'll pass it back to you.
Thank you,
Dr. Taylor.
Thank you very much. Anyone got any questions regarding what has been presented now?
Thank you very much. It's really good to see the progress that's been made since we did the review. I suppose I would just acknowledge that we need to do more to join up all of our co-production through health and social care. In this paper, you know, we've got a lot about the communication through the adult social care newsletter and things like that. But I think we need to do much more to make it a health and social care co-production place, and really think about the routes to co-production we have through the NHS as well, and how we join all of that.
Anyone else with any questions? Anna?
Thank you, Chair. I think mine was just a comment. Thanks, Avatar and Connor, for going through that, and Polly. I think it's a really good example of from the health and wellbeing strategy we'll touch on later, in terms of how we're trying to make real practical changes in terms of changing that relationship, and like you said, flipping it around the other way. I think just for the board, I think it's really important for the board and the infrastructures underneath it just to hear the learning from it as it goes, and the same with anywhere else, council, CVS, Healthwatch, NHS, just really hearing how that's working, and I think really hearing from the residents who are part of it. I think that's really important, because there's always be barriers that come up, things that feel hard, things that change. So I think that's really important for the board. Thanks.
Kerry, you have your hand up.
Thank you, Chair, and thank you to Connor for coming on what we hope is going to be a regular occurrence where the Health and Wellbeing Board chairs come to, the Partnership Board chairs come to the Health and Wellbeing Board to share their views and expectations of services in Ealing for local communities, and also to hold us to account in terms of local residents and their expectations of us as a partnership board. So I think that as a Health and Wellbeing Board, so I think that's really key. I think the bit that's going to be really interesting and challenging is engaging the co-production space across health and social care and the voluntary sector, and understanding and mapping that. And maybe part of our next steps is to look at the wider engagement co-production space and to understand where there's overlaps, as Councillor Newstubb has mentioned, overlaps, but also to ensure that we're amplifying and maximising the impact of local people on our activities as keep on mixing up our partnership boards and health and wellbeing boards, as a health and wellbeing board, and being accountable and responsible to the community. So I think that's really important. So sorry, Chair, maybe that's something we can bring back in the new year, an updated position and a plan on how they're all going to align.
Great. Got a question screen from, is that Ray? Is it Roy? Roy, would you like to ask your question?
Hello. Can you hear me?
Yes, we can hear you.
Oh, good. Okay. Thank you for that presentation on the Partnerships Co-Production Board's update. Our question, I'm Roy Willis, Chair of the Ealing Reclaimed Social Care Action Group. Just to put our question, which is much reference is made in this paper to involving people with lived experience in co-production. How does the Health and Wellbeing Board intend to ensure that lived experience of service users is in practice actively engaged? For example, in the monitoring of the responder service now provided by Harrow Careline and commissioned domiciliary care agencies, now that Ealing Careline has been closed. So that's just a quick question in terms of how we will be finding out how the responder service is going to be monitored and reported back to Health and Wellbeing.
Thanks, Ray.
I think, Roy, if I may speak for you, there's sort of two questions there, aren't there, really? There's one about how do we make sure people are actively engaged, people with a lived experience, and I think that is always something we need to be very elegant at doing and achieving. And I think it's really important that we're mindful of the impact that involvement in these kinds of production boards can have on people, and that we're very supportive of those who are generous enough with their time to come forward. So I would hope and stress that care that we need to take across the board. In terms of Careline specifically, I know that there's various, we had quite detailed conversation in health scrutiny last week, and we've made commitments to come back, I think within 6 months, the chair said, to really understand the impact, if any, on our residents. And I know that Healthwatch as well are committing to a piece of work further down the line to be able to achieve that. So I don't think there's any issue with that kind of involvement. Certainly we want people to be involved as possible, and if it sits on someone's work plan suitably, then we'd be very welcome to have that involvement. But as I said, the pathway for scrutiny and for further investigation is underway, both within the scrutiny panel and within Healthwatch's work plan for, I think, next year now. David's confirming for those online. I'm hoping that is sufficient information.
Thanks for that, Polly. my perspective, I think is really important in terms of that lived experience with regards to co-production, but also one needs to be mindful that you need to be able to calibrate the level of expectation within the partnerships, particularly in relation to those lived experiences, and those expectations do need to be aligned amongst that partnership within those boards. Otherwise, quite often in these situations, progress can't be made because there are a mismatch of expectations and alignments within the groups. So I think that's really important going forward. Has anyone got any final questions before we move on? No, but thank you very much, Avtar and Kerry and Polly for that. And we continue, as Avtar said, to iterate the strategic framework with regards to co-production, and we will progress it over the coming 12 to 18 months. Right, okay, so the next agenda item we have is the Better Care Fund end of year report, and also the 24-25 plans going forward. So there are two things for us to do. One is to note the BCF end of year template, but also to agree that we'll receive future BCF updates at this board. So Avtar, is that, or Polly?
Thank you. That's me again, Chair. I mean, I'm not going to talk in terms of the specific detail around different elements, but other to say that the BCF is clearly a key enabler for driving really important improvements, particularly around areas like discharge pathways, where it's enabling us to work together more effectively, and we're seeing really, really strong outcomes there. It clearly outlines and underpins our commitment to community-based solutions, and you know, it would be remiss of me to say that Ealing, as a hugely diverse borough with enormous inequalities, going forward and beyond the current and past year, wouldn't want to see any reduction to this. And I think in light of the Darcy report and an emphasis on better and joined up community preventative solutions, that we'll be seeing further funding coming through to support these kinds of areas where we can work together. And obviously everyone here, within the context of being members of the Health and Wellbeing Board, we all have a key and specific responsibility to the system within Ealing. So obviously it'd be remiss of me as the politician in the room not to mention that, but I think it's really significant to see the very real impact we can make on supporting people back into independent lives, and the impact that in turn has on some of our more acute provisions across the borough. So I'll leave it there. Avtar, you may want to add more on the specifics and the sort of nuts and bolts of it, but that's my setting out my stall, as it were, to make a position of defence for Ealing in the coming years.
Thank you. Okay, so I won't go through the report in detail. I assume it's been read by members of the board. I think it's important to state that a key condition of the Better Care Fund, in terms of the planning, the approval, the kind of with the funding, is the Health and Wellbeing Board do have oversight and approve the plan. Unfortunately, due to the timetables of templates being nationally produced, it tends to be quite late in the financial year. So whilst our intention would be to do this proactively, this tends to be a retrospective report going submitted to this board, but we do have delegations from the chair to approve, and the chair has been involved in the development of the plan and approval of the plan, as well as key partners across the stakeholders. This is a key enabler for integration. It's a key enabler in terms of setting out our stall as a partnership, in terms of how we're going to work jointly together to improve the health and wellbeing outcomes for residents, and that's across the spectrum. The Better Care Fund does have some national targets and some national conditions. We have complied with all the national conditions, submitting the reports, submitting quarterly reports, but also making sure that our expenditure and our actions are linked to the key metrics outlined in the Better Care Fund. In terms of methodology, this is not done as a standalone project. There are several meetings that take place across the partnership to agree challenging but realistic targets, to agree the expenditure, and in terms of how we're going to actually administer the Better Care Fund. Integral to the Better Care Fund is the legal framework for actually pooling our resources and our funds and our budget, or transitioning NHS monies to the local authority, and that sits through the Section 75. In terms of next steps, Section 75 has been updated, is subject to a variation. It will be signed off by the end of this month, which is a target that all Health and Wellbeing Board areas have, and that will ensure we are fully compliant. There is quarterly assurance reports in terms of how the Better Care Fund is making an impact, and we submit reports in terms of our financial activity, key data in terms of admission avoidance, hospital discharges, and the number of people that actually benefit from the expenditure. In the report, we talk about we provide some very good examples about the impact of the Better Care Fund, and we talk about admission avoidance through the homelessness work, improving patient discharge through the chills, and the step down for mental health beds. So that's 3 examples around the impact it has. I think it's worth noting this is a fraction of the spend across health and social care in terms of delivering outcomes for local residents. For the previous financial year, 2023-24, we have fully spent our money and the fund. For 24-25, we fully intend to spend the money as well. So plans are compliant, and there is very little room for manoeuvre or additional changes.
Thank you very much, Avatar. Questions? Kerry.
Thank you, Chair, and thank you, Neha. I think it's really important that we as a Health and Wellbeing Board recognise the huge amount of co-productive work as a system to get to the point to have an effective sign-off programme and management of the Better Care Fund. I know other parts of the system in North West London aren't always as smoothly run as we are in Ealing. I think it's really important that we recognise that and the contributions from officers within the NHS and also within the council to get us to a position of sign-off. So I think it's really important that as a board that we recognise that. I think it's also really important as a board that we recognise the risk that's associated with the ongoing review at North West London level with regards to the BCF allocations, recognising that it's a really challenging financial time within the NHS and local government and the public sector as a whole, but the impact of reductions or potential reductions in the BCF allocation for the residents of Ealing are significant, as Councillor Newstubb mentioned. If we reduce investment in the community, there's knock-on impacts on general practice, on acute sector services, on provider trust services, which we know are more expensive functions than the community response. And I think it's just important that we keep a very close eye on some of the decision making at North West London and act cohesively in terms of our response to any potential changes which may be proposed. Thank you, Chair.
Now?
Thank you. And just to add to that, I think there are a couple of other things. So the review across North West London is about looking, because we are now an integrated care system. So it's about, and historically when the Better Care Fund was first developed, it was 8 individual boroughs across North West London developing the schemes and having their own systems and processes in which to agree where the funding is set for that borough. The review, now that we're one, the health contribution is from one North West London Integrated Care Board, it is really important that they look, that we look consistently across all of the boroughs about the investment and making sure it is fair and equal and aligned to the needs of the local population. So I see it as a potential for opportunity as well as a potential for risk. So and it's really important that we are fully engaged and really a part of the whole process and developing all of the evidence base, etc. I think the other really a big thing to note is we as yet do not know what the Better Care Fund will look like for next year from National, because it was a 2-year Better Care Fund that was published, which comes to an end at the end of March 25. And inevitably, where in September it takes time to develop these very large funding schemes and working with all partners to really ensure that the funding is going to what we need it to. So it's going to be a tight timescale to get ready for April as well. And I think it's really important that the Health and Wellbeing Board recognise that, seeing as it is responsible for signing off the Better Care Fund.
Yeah, absolutely. Now that's really quite an important point in relation to 25 and beyond. I think it would be important also to acknowledge in the minutes the effort everyone's made for the year off sign off for 23-24, because a significant number of individuals and providers and organisations have contributed to the Better Care Fund over many years. And as Kerry now says, that we've got an excellent track record in relation to the Better Care Fund, but also in terms of that collaborative partnership working. And so, it's a credit to all of us who have been involved with the Better Care Fund for a number of years, not just in 23-24. Kerry?
I thank you, Chair, and completely support your point. I think Neha's point with regard to when we get confirmation of a position for 25-26, we probably need to look at that sort of in terms of a formal response process and how it fits in with the timescales of the Health and Wellbeing Board and sign off. So I think that's something, if I take away with Anna and check the timescales with yourself, Neha, so that we've got a clear framework for responding to any potential changes to the budgets.
Chris?
Thanks. I won't repeat the points from a kind of borough-based partnership perspective that Kerry and Neha have well made. I guess I wanted to acknowledge the fact that the way the Better Care Fund is structured in Ealing reflects a decade of really positive integrated working between the local authority and the NHS, and it does have some local nuance which my organisation that benefits my organisation, given the way that the Community Health Services contract is structured. So I definitely support the point that Kerry has just made around making sure that those of us who represent Ealing at North West London are able to advocate for a pragmatic solution that allows us to deliver the standardisation that might be being sought without any adverse effects on the Ealing resident. So I support Kerry's suggestion.
Great. Any final questions, Polly?
Well, I was just going to say, because I'm relentlessly optimistic, that I love Neha's proposition that it's an area potentially for opportunity as well as risk. So, we're all in a position of uncertainty, and it's good to know that we share that optimism.
Great. Okay. So just to note again that for the board, we note the year-end template for 23-24, and obviously, as one would expect, we will continue to have BCF updates in future board meetings as well. Good. Right. Let's move on to the health wellbeing strategy annual update and also the year 2 action plan. And before I pass on to Anna, I have to really commend the annual update, in particular in relation to the 58 actions which have been highlighted in the report. So that's really been a significant mammoth task in terms of what has been achieved in year 1, and clearly we look forward to what we are able to do in year 2. So Anna.
Thank you, Chair. So I'm going to hand over to Gabby in a minute. So Gabby started at the start of summer as one of our new consultants in public health and done a stellar job getting to know everybody and finding things out and pulling it all together. So big thank you to her and colleagues. Really just wanted to bring this here to celebrate what we've done as a partnership. This is the partners sat around the table, as well as our partners that are on the screen, especially VCS groups, communities, etc. There's some really great examples in here, case studies in the slide set that are being circulated. We have got a pack of papers here. So one is slides which Gabby's going to go through in terms of the summaries. There's also a line-by-line action plan from year one with responses against where we're at. You'll see most of them have either been done or we're in train because they're more than 1 year. There's one or two that have been slower, mostly because certain posts haven't been filled, etc. But I think that work really feels like it's moved on. I think Gabby will reflect on some of the cross-cutting things, like some of the culture changes. It does feel different when you look back a year or 2 years ago in terms of some of that commitment to partnership working, that understanding of different parts of our organisations and communities that can really are doing great work in terms of improving wellbeing, reducing inequalities, not necessarily see themselves as health. And that's great. And we're really reflecting that, I think, in the borough-based partnerships. So all the groups that feed into the board, you can really see that coming through a lot in the last year. We've also put in there the action plan for year 2, tried to make it a little shorter and a little neater. That feels like it's got really, really good buy-in. I think one important thing to reflect for this year is that there's actually a lot of partnership groups now in place to take these forwards rather than nicely volunteered individuals. That feels really good because actually a lot of the actions, there's a few simplish ones in there, but a lot of them are partnership ones where actually you do have people with different perspectives and you do need them to come to a new way of working to take these forward. So that feels really good. So if you're happy, Chair, I'll hand over to Gabby. You're going to take us through the slides and then obviously a chance to ask any questions at the end.
Great, thanks, Anna. So yeah, I'm Gabby Wolf, consultant in public health. And leading on the health and wellbeing strategy now, and one of the actions was for the year 1 of the strategy was to put in place my role. So I've been in post a couple of months and have been sort of getting updates on from partners on year 1 actions and helping to sort of bring partners together to develop the year 2 action plan. So as I'm sure you're aware, this is a 5-year strategy from 2023 to 2028. This is very much a partnership strategy, so across the borough-based partnership. So just a sort of bit of a recap on the strategy. This was had a vision for Ealing's communities to be thriving with good health and well-being, with fairness and justice in the building blocks of health. And there have been 3 main themes for the strategy to deliver. These are putting communities at the heart of everything, systems and structures that leave no one behind, and connecting the building blocks of health and well-being. And over the last year, so the first year of delivering the health and wellbeing strategy, there's been a huge amount of work across partners. And these are just some of the fantastic photos from some of the activities that have taken place. So I'm first going to go through some of the achievements from the year 1 action plan, and you'll be able to see this sort of line by line updates in Appendix 1. So as Anna mentioned, there have been some really good cross-cutting achievements. So things that maybe are less kind of able to sort of pin down, a bit less tangible, but from talking to partners, there's been a real shift in culture and language. So a much greater culture of partnership working, more and better understanding around the importance of the building blocks of health and well-being. And there's been specific structures implemented. So it's, for example, Homeless Health Board, for example, for getting me in place in my role. And also the strategy has been used as a lever for accessing funding. And a good example of this is the National Institute for Health Research funding to establish the Health Determinants Research Collaboration. That has been a really sort of fantastic achievement that's come out of this. So kind of going through individually each of the 3 themes. There's, in terms of theme 1, around putting communities at the heart of everything. There's been, obviously, as I mentioned, there's the HDRC successful funding, We have the work that's being carried out around Your Voice, Your Town, so this targeted engagement across all the 7 towns, particularly accessing those residents whose voices are less heard. We've funding agreed and have started sort of taking forward a development of the Ealing Roots and Wings programme, which is a sort of targeted sort of engagement programme for the sort of Black-led community organisations in Ealing, where there will be sort of opportunity to bid for grants and have peer researcher training for these organisations. We have the Ealing Ethnic Minorities Forum, which I'll talk a bit more in a case study. There's obviously the initial steps taken to develop the Connected Communities Board, which I think will be really important for kind of taking forward some of the further actions within the strategy. We have the Do Something Good volunteering website that has been developed and has gone live. There's been community of practice established around community engagement. There's been kind of one initial session so far, but further work planned, and that's sort of within from colleagues within the council. Again, within the council, there's been some service design training for residents in Northolt to kind of enable skills around participatory and qualitative research and co-design skills. 35 staff across housing and customer services have been trained in user research, and this has been used to develop a project called Designing Crisis Intervention. And the change and transformation team within the council worked alongside more than 20 services to conduct qualitative and participatory research to support the design of new models of crisis intervention. We've had some great work around the Ealing Community Champions, which have increased their numbers over the last year, increased sort of more co-design, and lots of other kind of projects that have happened with them. We've had the Family Hub Discovery phase completed. We've had the draft of the Race and Health DSNA completed, and there's been some additional work, for example, around mental health, where a NHS-funded programme for 30 people in the Polish community who attended a 12-week programme around mental health and well-being. And just one example of a case study kind of which demonstrates taking forward this, putting the communities at the heart of everything. We've got the Ealing and Hounslow Community and Voluntary Service, who have established their Ealing Ethnic Minorities Network Forum, and there have been 62 actively engaged members of voluntary community and faith sector organisations who have joined. So far, there have been 3 network meetings, and there have been kind of the speakers from NHS and from the council. There's been some really key kind of dissemination of health messages, for example, around TB. It's been a really useful kind of environment and forum to share kind of good practices and ideas between organisations. And they've developed a training programme with upcoming sessions around leadership training, diversity, inclusion, marketing, and social media training. So this is all around trying to empower community organisations and improving kind of their effectiveness. And they've also developed a diagnostic toolkit for organisational sort of health checks, covering things like fundraising, governance, and business planning. So in terms of theme 2, again, we've had loads of good examples of work across Ealing. There's been funding agreed and a working group to establish our Healthy Ealing team. So the plan for this team of 3 will be to kind of organise, facilitate, deliver, work with partners around reducing health and social inequalities, health promotion, engagement with communities. There's also been the SEND strategy completed. We've had the youth justice and GP pilot, which is improving access to GP services for those in the youth justice system, has been implemented. And there have been 5 oral health outreach events across the borough. So this is particularly, and this has brought together lots of different services to kind of maximise opportunities for for sort of accessing services such as around school readiness, child weight management services, children's centres, immunisations, job centre, community champions and children's service staff, whilst families wait for their dental check and whilst children wait to have their fluoride varnish applied. So really kind of maximising opportunities there. There's obviously been a lot of work within the council around reducing digital exclusion, for example, by donating retired devices. We've already discussed today the Adults Partnership Board restructure. And then there's also been the Ealing Speech and Language Therapy Bilingual Co-workers who've been in post for a year, and there's further funding for an additional year. And this has been a project around having sort of bilingual staff working with the speech and language therapy team to improve access to services for diverse communities, ensuring there's kind of provision of home language assessments and therapy, and cultural awareness sessions for staff, and that's been really successful. And one of the examples of a case study for taking forward theme 2 has been the 14-day temporary accommodation step down for homeless patients. So those who have an Ealing connection, those homeless patients who are being discharged from either Ealing Hospital or Northwick Park Hospital and who otherwise would have been discharged to the street, have actually had a step down bed in a hotel for up to 14 nights, but they've also had access to a number of other services during that time. And there's been really good savings that have been evidenced due to the number of bed days saved from hospital, avoiding hospital readmission. And finally, with theme 3, connecting the building blocks of health and wellbeing, we've had 15 of our community champions have been trained in mental health first aid, which they can obviously take back to their communities. There's been the development of the Ealing housing strategy, and then also the Ealing homelessness and rough sleeping strategy, currently under development. We've had the beginning, some work started around kind of across northwest London around identifying gaps in social welfare advice and specific recommendations and around Ealing as well. So we're awaiting a report around that and how we can where we need to make improvements there. And we've also got our accessible inequalities, health and wellbeing data platform, which has there's a demo ready and it's due to go live at the end of this year. There's the London pilot of the free school meals for primary school pupils has been rolled out with over 9,000 additional meals to Key Stage 2 pupils. We've had a total of 56 GP practices across Ealing achieving the Greener Healthcare Initiative, so that they're kind of taking actions to improve environmental sustainability of their practices. The Creative Mind projects, which I'm going to go into as a case study, has taken place. So this was a programme which was designed for young people between 13 and 18 years old to increase access to arts through a sort of creative space, to highlight the kind of the benefits of arts and creativity on mental well-being. And this has this was run by the Young Ealing Foundation and Mind at Hammersmith, Fulham and Ealing and Hounslow, where practitioners and art therapists have worked with 30 young children with 3 different parts to this programme on visual arts, music and on drama. And the evaluation's underway, but you know, this has been, I think, a very popular and successful programme for young people in Ealing. So now moving on to the development of the Year 2 action plan, and that you will have seen is in Appendix 2. So the Year 2 action plan has been developed through sort of conversations with directorates within the council, within colleagues across the borough-based partnership, and particularly kind of around talking to colleagues who've taken forward that Year 1 action, those actions and where they see those actions going for Year 2, as well as kind of identifying some additional opportunities as well. And then we've also had our health and wellbeing strategy workshop in May. We had 64 colleagues and residents across Ealing come together to reflect on the achievements of year one and then sort of co-develop some of those year two actions. And there's just some pictures from the workshop, but we had a number of kind of different things come up, some examples around sort of points raised around the importance of ensuring that we really embed more voices with lived experience when kind of developing strategies. And I think that's something that's come up quite a lot today. We kind of have more community-led campaigns, so kind of very much sort of relevant to our community rather than kind of focusing too much on the kind of the nationally led campaigns. Thinking about how better we can support access to services through things like hubs, buses, navigators, ensuring that when we do engage with the community, we have a playback strategy so we can show people we've listened and what the outcomes of their engagement has been. And thinking about kind of innovative ways to really bring the kind of the building blocks of health and well-being together, for example, around kind of job swaps, shadowing, those sorts of things between different departments, so people can really understand what's happening in different parts of the system. And the overall, the format's fairly similar to the year one action plan, but we've got a section around cross-cutting themes, so recognising that some of the actions are kind of work really across delivering all three of those themes. For example, kind of how best to use kind of the Health and Wellbeing Board going forward. But then we have specific theme-based actions as well. So that's it for me. And any questions?
Thank you very much, Gabby. Questions? David?
Thank you, Chair. And first, I just want to echo Vijay's words and everyone else's that this is a tremendous piece of work, and I can tell obviously a lot's been put into it. So I want to commend you all on that. One piece in particular that I wanted to ask about was the 14-day temporary accommodation for the homeless population. Because it's such a vital piece of work, and it's important for long-term health, and it also saves money on the NHS. Do we know what the next steps for that program are? Is it going to be expanded? Is it still in a trial phase? What's the future look like? Thank you.
I will let Neha answer that question.
No problem. So these beds were actually funded through the Better Care Fund discharge monies that we received over the last 2 years. So it's very much linked to the Better Care Fund. We're very hopeful that we'll be able to continue this type of program, but I think the real strength of this is that the connections that have been created as a result of it, and the Homeless Health Board that is now meeting on a very regular basis with all of the different partners involved in homeless health, are really coming up with some really innovative ways of supporting our local homeless community and thinking about what they can do more proactively as a collective. Some things will need funding, some things actually it doesn't need funding, but I think those creations, those connections that have been created as a result of doing this type of a work will make it a bit more embedded within North West London, but I'm really hopeful that we'll also be able to continue this type of work in the community. There is already other work that's happening within the hospital, which I see Jo has put her hand up and I'm sure will want to come in.
Jo, do you want?
Yes, thank you, Vijay. So, sorry, I'm Joanna Paul, Director of Operations at London North West Park Ealing Hospital. Just to really add to that, so we have a team, a homeless team based here, practicing inclusion health, and I think the key arm of this is the ability for them to flex accommodation linked to local support agencies when patients are medically fit and optimised and able to leave the hospital but have no accommodation and need further support. So there's some very key requirements that we work with to offer this, but it's linking people into a wider group of local communities and teams to help provide support. It can be as simple as well as 1 or 2 nights as a temporary while they're waiting to get into somewhere else, or it can be as a starting point to try and get them back with infrastructure and support to get back on their feet, linking in with local teams. So I think the work that we're doing around this is about kind of looking at the criteria for which we extend this to other individuals, and then looking at further opportunities to try and link them into longer term accommodation options.
Thank you.
Thanks for that. Thank you very much for that, Joe. Anyone else got any comments or questions they'd like to make? Kerry.
Thank you, Chair, and thank you, Gabby, and as we're all recognising a huge amount of work here. The bit I think that's really interesting with us as a Health and Wellbeing Board is how do we ensure that the strategy changes our direction of travel and improves the outcomes for local residents. It's something Anna and Gabby and I have had some discussions about. Some of this work was in train anyway, but we need to try and turn the tanker to a more building blocks of health focused approach across the public sector. And I think it's something that we need to keep in mind when we receive future reports on the health and wellbeing strategy. It seems a little bit unfair because this is still year 1 and this was always a setup phase. But I think probably this time next year, we should see more strategic shift in terms of how we're providing services. And as a board, we need to hold ourselves to account to responding to the building blocks of health.
Yeah, absolutely. There will be a time as we move forward that those tangible differences, it's important that we continue to demonstrate those, but also as a strategy in the board to really showcase that to the wider boroughs across London as well, in terms of what we've been able to achieve in Ealing. I think that's going to be really important for us. Are there any other comments you want to make, Polly?
Yeah, I just want to say how fundamentally, and I think Gabby, thank you for the report and for your presentation, mentioned culture change at the beginning, how fundamentally this is serving as a vehicle for transforming the relationship that we have with, in the main, our CVS, but via them, our residents. And the one-day strategy day really was quite something to see so many professionals from health services, from our CVS, from our own services. So it's not only driven that cooperation and built that trust between us and our residents and our CVS, but it's transforming the way that we think about things within the council, and really serving to break down some of those kind of historic and perhaps inevitable but regrettable barriers between different services who are all very focused on achieving their own ends, but really to think about the integrated approach that we need to have to an individual's or a cohort of individuals' needs, and that is proving pretty exciting, I think, across the piece.
Absolutely, Polly. So unless there's any other questions, I can't see any on the screen either. So the board, we have 2 recommendations for the board. I'm going to do number 2 first. So the first one is to note the achievements for year 1, and then the second recommendation is for the board to agree and sign off the year 2 action plan. I just one note from the year 2 action plan is that yes, we are being ambitious and aspirational. We have 48 actions in year 2. Clearly, some of them are a rollover of year 1, and I think it is important that we continue to be ambitious and aspirational, but also we need to be realistic and achievable as well as we go into year 3 as well. So does everyone agree to sign off the year 2 action plan? Yeah, great. Okay, everyone, thank you very much for that.
Right, okay, let's move on to the next agenda item, which is Health Watch's Q1 report and also the Community Diagnostic Centre Enter and View, and that took place on the 30th of January this year. So, David?
Thank you, Chair. My name is David Crawley, and I am the Project Officer for Health Watch Ealing. I will get started by letting everyone know what our work plan is for the year. We are continuing our patient experience program. There have been some changes to our reports, but I'll get into that momentarily. Our Enter and View program, where we enter facilities that are within the health and social care remit and see what is going well and what could be improved. This year, we'll be focusing on mental health hostels and care homes that deal with mental health. We will be conducting 8 of these. Enter and Views, 2 have already been done. We're doing another tomorrow, and others will be scheduled further throughout the year. As for our research projects, we are examining the experience of the homeless population in Ealing to see what their experience has been like with the NHS. By homeless, we mean those who are without permanent accommodation, rough sleepers, asylum seekers, sofa surfers, etc. Another project we are doing is we are planning to examine cancer screenings in Ealing to see what the uptake is like, what people's perceptions of cancer screenings are, and finally, through external funding through Health Watch England, we are doing a study on long-term eye care, focusing in particular on individuals who are at risk of conditions such as glaucoma, cataracts, etc. Before we move on to the Q1 patient experience report, does anyone have any questions about our work plan?
Chris?
Hi, David. Thanks. It's great to hear that you're going to be using the Enter and View powers to look at mental health hostels and care homes with mental health. I just wondered if it's worth a conversation with us as the Mental Health Trust to see if there's anything we can, anything that would be useful for us collectively to ask whilst you're doing your Enter and View visits while you're there, in respect of the residents' experience of liaising with mental health services. I'm happy to have a conversation outside.
Definitely.
And the same would apply, I guess, to the homeless population. We've obviously got the RAMP service, which is the Rough Sleepers Mental Health Service here, based in Acton, and really keen to see if there's anything we can contribute to, and also to help you identify individuals living with homelessness, because the RAMP team has expertise in tracking down individuals who may be street homeless.
That'd be excellent. Thank you, Doctor. Definitely. We'll have a conversation outside.
Anna?
Thanks, thanks, David. That's really helpful. I think just similar with the screening inspection, I think that's really great. We've been taking a paper in the spring to Health and Adult Scrutiny, which I think you might have been at. And I think it would be really good to think about focus areas. I know there were definitely things about accessibility in terms of, say, disabilities raised. And obviously there's lots of different screening programs. So that would be really good just to think about where we could focus so it doesn't feel too widespread.
Yeah, for the hi, my name is Ruchi. I'm the project officer for Health Watch Ealing. And for cancer screening, we are actually working very closely with Macmillan, and they are conducting a cancer awareness project in Ealing. So we are undergoing certain trainings, and from what we have understood, breast cancer and cervical cancer are one of the big areas that we really need to look into. So yeah, that is part of a plan, but yeah, happy to have a discussion outside.
Okay, thank you, everyone. So moving forward, our patient experience report for Q1, which was April through June of this year, we collected 1,308 reviews from 50 visits. As you can see, I'll take it as the report has been read. I will just point out highlights. So this report looks different from what we've produced in the last year because we determined that we were getting the most impact from our patient experience program with GP reviews and hospital reviews. We are still collecting data regarding dentists, pharmacies, etc., but those will be done as annual reports where we will get more impact. For GP reviews, we got 482, 71% of which were positive. Highlights from GP reviews include people really liking the health professionals they speak with, staff attitudes have been highlighted as good, people like the quality of treatment that they're receiving. The things that people said could be improved about GP surgeries, appointment availability, getting through on the phone, booking appointments, and the level of staff in surgeries. These are obviously continuing issues that we've seen before. Our recommendations to help with these issues include promoting online booking systems to reduce pressure on phone lines, improving the appointment booking slots where instead of having the 8 a.m. rush where everyone calls in at 8, have some available at 8, have some available at noon, and advertise that is what is occurring at your practice. We know that some GP surgeries are doing this already, but perception is key. And finally, explaining why people are seeing locum doctors. We understand why locum doctors are being used, but people can be frustrated by not seeing their doctor and they might not know why. So explaining and being proactive in that might assist. Going to hospital reviews. People again highlighted how they enjoyed interacting with staff, the quality of treatment, and how services coordinated with each other within hospitals. What they thought could be improved were waiting times, appointment availability, and communication with themselves and communication between services. What our recommendations are for hospitals to help alleviate these are establishing continuity of care for patients to improve communication, for their treatment plan, hold regular multidisciplinary team meetings to discuss complex cases, to ensure all involved doctors and healthcare professionals are on the same page regarding the patient's treatment, which can then be communicated directly to the patient. Improve appointment scheduling and management to reduce the negative sentiment regarding appointment availability. Hospitals should focus on reviewing their appointment scheduling processes to see if it could be streamlined and improved. And finally, implementing an improved communication system between different practices, between a hospital and a GP surgery, streamlining communications so patients feel everyone is on the same page. Again, on hospital reviews, we had 328, 80% of which were positive, 6% negative. Those are the highlights from the Q1 report. Do we have any questions regarding that?
So, David, let's do the question on the screen. I've got Roy, who may have a question around the action plan. Roy, do you want to ask your question?
Yes, thank you. I did Yes, I did indicate I was going to ask a question on the work program, and I think you may have missed my hand being raised, but not to worry. Just to ask, where in the Future Health Watch program of work are there any plans to monitor the provision of social rather than medical care to Ealing residents? Obviously, we're very aware that medical and social care are very closely linked and support one another. However, it does seem to be rather dominated by hospital, GP, and other medical services. And I think we've discussed before in the scrutiny panel and in health and well-being about how Health Watch could look at not just at care homes, but also people in receiving other social care services at home or at day centres. Thank you.
Thank you, Roy. David?
Yes, and I hear you, Roy. That is something that we always consider when we develop our work plan. And that typically is where our Enter Review program tries to highlight social care. That's part of the reason we are doing the mental health hostels, most of which do not provide care medically. But there's definitely something, especially I know Harrow Careline has been on everyone's minds. We are going to be focusing more on it in the future. We're dedicating a project to Careline for next year's work plan. But thank you for your point.
Holly?
Thank you for that.
Yeah, can I just come back on that?
Yeah, sure. Go on, Roy.
Yeah, specifically, the report mentions an Enter Review study of Ealing Community Diagnostic Centre, but it also cites data protection problems when explaining that it's no longer that Health Watch no longer intends to carry out an Enter Review study into the new Harrow Careline services. I know you're going to do a different sort of study, but we don't really know the details of that.
Polly, do you want to respond to that point?
Yeah, I mean, just to answer that, I mean, it's I've been to Harrow Careline and was enormously impressed by the staff that I met, the reports that I saw, the data, and the professionalism and the compassion that the people working there have. But ultimately, it's a telecare provision. It's in essence an extremely sophisticated call centre. So in terms of what you might see, it's somewhat limited. So I think, and I'm speaking on behalf of David, there was an Enter Review plan for Harrow Careline. In reality, you can't sort of sit there and wait for someone to have a fall and to activate their their call upon the services. So that combined with data protection issues in terms of being able to access those clients in real time and to do a really useful Enter Review, as I understand it, is the reason why that was chosen not to be done, and instead to do a much more in-depth, productive project next year when they can. Obviously, we've just reviewed the work plan for the rest of the year. It is pretty busy, and being able to go to somewhere like the new diagnostics centre, you're going to a place, you're meeting probably with patients, you're there with the professionals and the healthcare professionals who are providing that service. It's quite a different element. So I don't think it's that, and again, I'll let David speak for himself in a moment, but I don't think there was any sense that it wasn't an area of interest for Health Watch. And certainly there was no, we were absolutely comfortable for them to have that conversation, but that the mechanism of Enter Review wasn't suitable for the provision for that type of service, and that a project will much better serve the sense of what it actually delivers. I'll pass over to David to corroborate or otherwise. Thank you.
No, yes, thank you. That is exactly why we thought initially an interview would work and we could work it into our work plan for this year. However, an interview is something that occurs on the day where we talk to staff and residents. It's a one shot. The report can be longer, but the main meat of it is done on a single day. Because it is not within their GDPR agreement with Careline to just give us phone numbers so we can call them ourselves. That violates data protection. We were unable to do something like that. So going out into the community, doing a larger project is more appropriate because this is an issue that we care about. And we want to do the people who are service users with Careline justice with our work.
David, before we move on, just any other question? I've got one question for you, Polly, in terms of what you just said about a more detailed project around the Careline. I just want to try and understand in terms of the data protection around that. So I assume that'd be much more of an in-house project review to overcome the data protection issues. Am I right in that?
Yeah, I mean, we have a constant management and oversight. I know Avatar goes up, I think, once a month to meet with the teams and to manage the commission service as we would with any of our commission services. So there's constant feedback in terms of the data. We now see much more on why people are activating their alarms, what times of day. We're much better able to integrate that with our adult social care partners and professionals to be able to tailor their care packages accordingly. So we're seeing an awful lot more information, and all of that is being managed on a day-to-day basis, as you'd expect any of our services to be. In terms of the project that Health Watch will run, I imagine that some of those areas around GDPR and access to the clients will have to be worked through. But given that project will happen next year, we've got plenty of time to do that. And it may be that we need to call upon people to volunteer. There will be user surveys and so on as part of the normal management of the service anyway that Harrow conduct, and they are in constant communication with many of the users of the service in any case. So we have that feedback loop both between Harrow Careline and the users of service, and through the normal management mechanisms of the service itself.
Thanks for that point. Kerry, did you want to come in?
Thank you, Chair. It's a slightly separate and different point, but also that we need to remind ourselves of the huge amount of work that adult social care has done with Careline over the last 2 years with regard to enter and view programs and visiting care homes for older adults, specifically our PFI partners in the borough, has had a huge impact in terms of the quality oversight of services and the forward planning for this year. And the current programme around mental health hostels was in response to the investigations into the tragic death of Jenny Foote many years ago in Ealing, and I think that continued focus and working in partnership with Health Watch is really important. I wanted to ask one question on the report, if that's okay, Chair, just to move. In terms of the trend analysis, David, I see we've got Q1 data. Have we got any comparative trend analysis in terms of the information?
Yeah, so from Q4 of last year, we see the GP satisfaction was higher in Q4 than it is in Q1. But the other ticks were higher in this quarter. That we are going to keep an eye on that. We don't know if that's a long-term trend. We did get fewer GP reviews this quarter than we did last quarter. We had about 1,500 in Q4. So that might be why it's a few percent down. But once Q2 is completed and that report is available sometime in October, we'll get back to you and we can see if it's a trend. Yeah.
Okay, so before we move on to the CDC, any other questions regarding Q1 from anyone? Joe?
Yeah, just wanted to thank David for the detailed, really clear. A lot of echo from my end. Can you hear me?
Yeah.
You can, sorry. I just wanted to thank the team basically for a very positive, detailed and a clear report I felt, particularly noting, I'm pleased to say, positive response in relation to staff attitudes and treatment and care. Clearly a very important part of what we do. We note the are clear about the issues raised around waiting times and appointment availability, etc. and queuing, and this is going to go through to our patient experience committee, and we'll review and look at some of the suggestions made in a positive light and see what we can do with those. I just maybe I'll reserve any further comments when we come on to the CDC. Thank you very much.
Thanks, Joe. David, do you want to carry on CDC?
Yes, thank you, Joe, as well. So in January, we were invited by Mr. Titcombe to go to the Ealing Community Diagnostic Centre when it was in its early trial phase. And we got to speak with staff and patients who were using the CDC in the very, very beginning. And overall, it was a very positive experience. Patients highlighted that their appointments were on time. They found staff to be professional, communicative, and respectful. And a key thing that they highlighted, and hopefully this is something that continues in the full CDC, is that they liked that it was separate from the main hospital. They felt that because this is a separate facility, they are not sick, and it made them feel better. Some things that patients told us could be areas for improvement were how easy it would be to find the CDC. Some told us they had difficulty finding it in that early trial phase. Some said they had issues with parking and there was a lack of spaces at the CDC and the main hospital parking. And obviously, they have since done a lot of construction. There's now a separate entrance to the CDC, so hopefully that has been taken care of. Some highlights from staff, their feedback. They told us that the number one thing that they enjoyed most about their job was working in their team, that their teammates were great, and it made it a very positive experience working there. It made their days better, and it made what can be a difficult job easier. Staff mentioned that in the early trial, scheduling was tight, where there was not a lot of time between patient appointments, and if one thing was missed, that could cause delays. They mentioned language barrier issues with patients and further training being asked for. Our recommendations for these issues included, for patient feedback, making sure in the full CDC there are clear signs on where to go and that there are further disabled parking spots put in front of the new entrance. Where appropriate for those who do not speak other languages, produce material that is available in other languages that are on display, and to be proactive in using the translation services. One last thing that I'll highlight is patients didn't know what the CDC was at first. It's brand new concept, and this is the biggest and best one in London. So they needed time to learn what it was. So we recommend, as now it's fully operational, we be proactive in promoting it in the community, letting people know what the CDC is. If there are any questions, please let me know.
Yeah. Joe, do you want to come in here now?
Thank you very much. Yes. Thank you for that. And just to say, I'm delighted to report that following your visit and with a lot of hard work, we opened the unit formally on August the 12th. So we're now, the CDC is open. The facilities, I think that David was reporting and saw were temporary locations of service that we were providing CDC, so the community diagnostic community activity from, pending the opening of the main unit. And I hope, David, when you come along with other patients and teams, that you see a facility that actually is what I hope and we aspire to for all of our services. There is dedicated parking for disabled access. That's the front, just to answer the queries on that, as well as a drop-off area. The main access is through the normal routes of access through the hospital, in terms of coming on by bus, by the Elizabeth line, and or by vehicle. Signage and wayfinding has been very clearly put in place. And there's a much wider strategy of wayfinding that we're implementing at Ealing, but it is already in place, obviously, for the CDC. And I hope you find as well that that's clearly articulated. We've not had any problems thus far. So we welcome a return visit to see what's in play. And we'll be looking to build on the issues around improving wayfinding across the organisation, but also some of the comments around language and things like that into the services and into signage and work moving forwards. But I'm very happy to take any comments or any feedback, training, recruitment, and all of the work with staff inevitably also in play.
Thank you, Joe. Anna?
Thanks, David, and thanks, Joe. Just a really minor one. I think it's really helpful report and really good recommendations. It'd be really interesting, maybe to Joe, just see learning about the languages. Obviously, this is a new service, new site, lots of people from different boroughs. Just be really good to kind of see how that's going and maybe bring that back from the trust. I think that's just it's ongoing learning for all of us.
And questions on the screen. That's Steed. Yeah, Councillor Steed.
Hi, good afternoon, everyone. I just picking up on one of the points that David made. I observed that all through the discussion we've been referring it as the CDC, and I just wonder whether for some patients that in itself may be somewhat confusing. But I've got no clever suggestion as to what else you should refer it as. But picking up on David's point that and on the signage and stuff. I don't know. As I say, all we've talked about is the CDC, so for obvious reasons. But what else do you call it? I don't know. Not very helpful comment in a way I appreciate, but you know.
Yeah, and Joe will know that the in terms of the CDC or the Community Diagnosis Centre, this was a sort of national terminology that was agreed by NHS England and others in terms of NHS providers. But it is a good point, and I do think there is probably still ongoing confusion around what does community diagnostic centres actually do and how that interacts with cancer diagnostic centres. I think there is some confusion out there in the community regarding that. Joe?
Yes, as I understand and agree. I think they are a new concept. But there are 160 nationally, so I think the knowledge of what the facility offers will expand, we are and will become increasingly commonplace. We have done quite a lot of work with our community, our communications team as well, to reach out for GPs and our other stakeholders as well as patients about the facility and what it offers is effectively a first step diagnostic facility for any pathway. So we're offering radiology, we offer X-ray, all the scanning services, all the imaging services that that GPs request, as well as some of the heart and respiratory tests that are required as well. So it's a kind of a one-stop shop for a whole range of first stop tests that are done before a patient would move further forward into a pathway of care to support diagnostics.
Any final questions or comments from anyone? Kerry?
Just a very quick comment that the HAS board will be attending the CDC. So Joe, you're going to get lots of visitors, but I think it's a really positive service and the level of interest and engagement reflects that.
Welcome. Great, thank you.
Absolutely. So thank you very much, David. Thank you very much, Joe, for your contributions. Okay, let's move on to the final agenda item, which is the borough-based partnership update and the impact of the ICB's organisational redesign in relation to services and the partnership itself. Now.
Thank you very much, Chair. I am going to share my screen just to show a few of the slides. So just bear with me. Okay, put on slideshow. So thank you very much. I just want to start by acknowledging how busy the slides are, and I've put in a lot of the content, but I'm not going to talk to all of that content in this meeting, but I'm really keen that the presentation that we gave at scrutiny panel last week also came here to the Health and Wellbeing Board. And that is because the Health and Care Partnership, the borough-based partnership, is made up of all of the partners within the Health and Wellbeing Board, and it's the sort of operational arm of implementing